1. The importance of joint health and the role of nutrition. Joints are incredibly important parts of the body, connecting bones together to form a flexible and efficient musculoskeletal system. Each joint consists of several components including cartilage, synovial fluid, ligaments, tendons, and the joint capsule. Cartilage helps reduce friction and absorb impact during movement, while synovial fluid lubricates the joint surfaces, allowing bones to glide smoothly and preventing damage. Ligaments and tendons maintain joint stability and connect muscles to bones to facilitate motion. When all these components work well, we can easily perform activities ranging from simple tasks like walking and grasping to complex movements like dancing and sports. However, over time or due to factors such as aging, injuries, or improper lifestyle habits, joints can develop serious problems. One of the most common and concerning issues is joint inflammation. Arthritis is an inflammatory condition occurring in joint tissues, leading to cartilage destruction, subchondral bone damage, pain, swelling, and reduced mobility. There are many types of arthritis, with osteoarthritis and rheumatoid arthritis being the most prevalent. Osteoarthritis typically results from natural cartilage wear and tear with age or prolonged joint stress. Rheumatoid arthritis is an autoimmune disease where the immune system mistakenly attacks healthy joint tissues, causing significant damage. Other forms include infectious arthritis, gout, and psoriatic arthritis, each affecting joints in different ways but all diminishing joint function and quality of life. The pathophysiology of arthritis is complex, involving excessive production of inflammatory cytokines such as TNF-alpha, IL-1 and IL-6, and overactive immune cells in the joints. These factors perpetuate chronic inflammation, destroying cartilage and bone, leading to pain and stiffness. Additionally, oxidative stress caused by free radicals damages cartilage cells, worsening inflammation over time. Arthritis does not only affect joints locally but also impacts the whole body. Inflammatory cytokines can circulate systemically, causing chronic fatigue, increasing the risk of cardiovascular disease, diabetes, and metabolic disorders. Chronic pain also affects mental health, increasing the likelihood of depression and anxiety, seriously diminishing quality of life. Nutrition plays a central role in managing arthritis. Numerous studies have shown that selecting appropriate foods can help reduce inflammatory responses, protect joint tissues, and improve mobility. Conversely, foods high in inflammatory agents, refined sugars, and unhealthy fats can worsen pain and joint degeneration. Nutrients like vitamin C, D, K, calcium, and protein are essential for maintaining joint structure and function. In summary, joint health is key to maintaining an active and quality life. Understanding the disease mechanisms and the role of nutrition helps you make informed choices to protect your joints, prevent inflammation, and sustain daily energy. 2. 3 vegetables to avoid for joint protection. Mechanisms and scientific evidence. When it comes to protecting joint health through diet, it's not only important to know what to eat, but also what to avoid, especially for those at risk or suffering from joint diseases. Among these, 3 commonly consumed vegetables, tomatoes, bell peppers, and potatoes, may exacerbate inflammation and joint pain. First, tomatoes are popular for their delicious flavor and rich nutritional content such as vitamin C and lycopene, a powerful antioxidant. However, tomatoes belong to the Solanaceae family and contain an alkaloid called solanine. This natural compound helps protect plants from pests but may trigger inflammatory reactions in some sensitive individuals or those with arthritis. Medical reports indicate that some rheumatoid arthritis patients experience worsened symptoms after consuming tomatoes or tomato-based products. Nevertheless, not everyone is affected similarly. Healthy individuals without joint issues can still enjoy tomatoes for their benefits. For those with arthritis or joint pain, eliminating tomatoes from the diet for a few weeks to observe body response is recommended. Similarly, bell peppers also belong to the Solanaceae family and contain solanine along with other alkaloids that can provoke inflammation. Despite being rich in vitamin C and antioxidants beneficial for immunity, bell peppers may worsen pain and swelling in individuals with joint inflammation. Some small studies and patient reports suggest symptom improvement after reducing bell pepper intake. However, if no adverse symptoms occur, moderate consumption is acceptable. Potatoes, a staple in many diets, also deserve caution, particularly for arthritis sufferers. Potatoes contain solanine, especially when undercooked or sprouted, and have a high glycemic index due to starch content. This can rapidly raise blood sugar levels, promoting systemic inflammation and worsening joint symptoms. Fried or oily potato dishes add to the inflammatory burden and are not recommended. Those with arthritis, diabetes, or at risk should limit or avoid such foods to protect joint and overall health. While tomatoes, bell peppers, and potatoes are common and nutritious vegetables, individuals with joint concerns should carefully control their intake. Listening to your body, conducting elimination trials, and consulting nutrition experts can help customize the best diet to reduce inflammation and joint pain. Identifying and avoiding foods that trigger inflammation helps slow joint degeneration, protect cartilage, and maintain mobility. This knowledge forms a vital foundation for building a healthy diet to improve quality of life for people with joint conditions. 3. Vegetables to favor for joint health, protective mechanisms, and scientific support. While some vegetables can provoke inflammation in sensitive individuals, many others provide essential nutrients that protect and strengthen joint health. These vegetables offer powerful anti-inflammatory compounds that reduce pain, improve joint function, and boost overall energy. Spinach is among the most nutrient-dense greens, especially beneficial for joints. It contains high levels of vitamin K, which is critical for producing osteocalcin, a protein necessary for bone mineralization and strength. Spinach also provides magnesium and antioxidant compounds like lutein and zeaxanthin that reduce oxidative stress and inflammation. Animal studies and some clinical research indicate that regular spinach consumption can reduce joint swelling and enhance mobility in arthritis sufferers. Broccoli is another popular vegetable rich in nutrients, notably sulforaphane, a compound proven to protect cartilage from damage and slow osteoarthritis progression. Sulforaphane works by activating detoxifying enzymes and inhibiting inflammatory factors like NF-κB. A 2012 study published in Arthritis and Rheumatology demonstrated that sulforaphane reduces cartilage damage and inflammation. Broccoli also supplies vitamin C and fiber, supporting immunity and overall health. Carrots, rich in beta-carotene, a precursor of vitamin A, provide strong antioxidant effects that soothe inflammatory responses and improve connective tissue health around joints. Diets high in beta-carotene correlate with lower risks of osteoarthritis. Carrots also contain vitamin C and various minerals aiding immune function and general well-being. Kale is a superfood loaded with vitamins C, K, and calcium, essential nutrients for bone and joint strength. Vitamin C supports collagen synthesis, the main structural component of cartilage and ligaments. Vitamin K helps regulate bone mineralization, preventing osteoporosis, while calcium maintains bone density and prevents fractures linked to joint degeneration. Frequent consumption of kale has been shown to reduce arthritis risk and enhance immune resilience. Incorporating these nutrient-rich vegetables into a balanced diet not only reduces inflammation but also supports cartilage regeneration, improves joint function, and promotes overall vitality. Preparing these vegetables with gentle cooking methods like steaming or light boiling helps preserve their valuable nutrients. Combining a variety of these greens in daily meals, salads, soups, or stir-fries can effectively promote long-term joint health. In summary, avoiding inflammatory vegetables while actively including spinach, broccoli, carrots, and kale creates a strong nutritional foundation that safeguards joints and maintains vibrant energy levels. 4. Habits to support joint health and boost energy. Protecting joint health goes beyond diet. It requires a healthy lifestyle and daily habits that support optimal body function in preventing and managing arthritis. One indispensable factor is maintaining adequate hydration. Water is essential for sustaining synovial fluid, the lubricating fluid within joints that reduces friction and prevents cartilage damage. When dehydrated, synovial fluid thickens, increasing joint stiffness and pain. Therefore, drinking at least 1.5 to 2 liters of water daily is critical, especially for older adults or those with high physical activity levels. Limiting processed foods, fried items, excessive fats, and refined sugars is also crucial in reducing systemic inflammation. These foods often contain unhealthy fats, inflammatory compounds, and preservatives that exacerbate joint inflammation and impair overall health. Epidemiological studies link diets high in processed foods with increased incidence of chronic inflammatory diseases, including arthritis. Prioritizing fresh, minimally processed foods helps better manage symptoms and supports joint function. Regular physical activity is an essential component of joint health. Gentle exercises such as walking, yoga, swimming, or Pilates strengthen muscles around joints, enhance blood circulation, alleviate pain, and improve flexibility. Research shows individuals who exercise regularly have lower risks of osteoarthritis and better mobility than sedentary people. However, selecting appropriate exercises based on individual health and joint condition is vital to avoid overload or injury. Additionally, incorporating omega-3 rich foods like salmon, mackerel, chia seeds, and flax seeds helps reduce inflammation by inhibiting pro-inflammatory cytokine production. Natural anti-inflammatory spices like turmeric and ginger have also been widely studied for their pain-relieving and anti-inflammatory effects, especially in rheumatoid arthritis. Adding these spices to daily meals not only enhances flavor but also provides safe, natural joint support. Lastly, adequate sleep, stress management, and maintaining a positive mindset play important roles in inflammation control and recovery. Sleep enables tissue repair, reduces inflammatory responses, and boosts immunity. Chronic stress elevates cortisol, promoting inflammation and joint damage. Establishing good sleep habits, practicing meditation, deep breathing, or engaging in enjoyable leisure activities can help manage stress and improve joint health. In conclusion, sufficient hydration, avoiding inflammatory foods, regular tailored exercise, omega-3 and anti-inflammatory spice intake, plus good sleep and stress management collectively safeguard joints, reduce pain, and increase vitality. Combined with a healthy diet as previously discussed, these habits form the key to a vibrant, active life. 5. Conclusion and practical advice for protecting joints and maintaining energy. Having explored in detail which vegetables to avoid and which to prioritize for joint health, it's now crucial to apply this knowledge practically and personalize it for your body. Understanding that not all vegetables are equally safe for joint health helps prevent common mistakes and reduce the risk of prolonged inflammation and pain. Tomatoes, bell peppers, and potatoes are common dietary staples, but if you experience joint problems or symptoms like pain and swelling, consider limiting or temporarily eliminating these foods to observe how your body reacts. Conducting an elimination trial of 2 to 3 weeks can help identify sensitivities and inform dietary adjustments. Simultaneously, increase your intake of nutrient-rich vegetables like spinach, broccoli, carrots, and kale. These foods not only reduce inflammation but also aid cartilage repair, strengthen bone structure, and improve overall wellness. Incorporate a variety of these greens daily and use gentle cooking methods to preserve their nutrients. Beyond diet, lifestyle habits significantly influence joint health. Staying well hydrated, maintaining regular gentle exercise such as walking or yoga, avoiding processed and inflammatory foods, and including omega-3 rich foods along with turmeric and ginger are all effective strategies for inflammation control. Most importantly, listen to your body. If certain foods worsen joint pain, avoid them and consult healthcare or nutrition professionals to develop a tailored plan. Joint health is a lifelong journey requiring persistence and care. By investing in proper nutrition and healthy habits, you will enjoy greater flexibility, reduced pain, and vibrant energy to live life fully.